Hey guys, today we're going to talk about why prevention is not your best option. That may be something that you think is surprising to hear from us, but the truth is prevention is a lower level than really what we can even be at. So that's what we're going to talk about today. Hello, I'm Dr. Brandon Buck, owner and founder of Advanced Health and Wellness Center. We specialize in functional medicine, optimizing health, corrective chiropractic, and just overall trying to improve our quality of life through health. And this is Leah, and she's our physician assistant, medical provider. We both have advanced training in functional medicine, as well as Leah also has advanced training in non-surgical orthopedics. So she does advanced injections and different advanced types of treatment for patients. And so if you've been watching our videos, you may have seen that we really try to emphasize our advanced health and wellness pyramid. And in the pyramid, we'll try to attach it here in below this video, but in the pyramid we have 6 levels. So the base level of the pyramid is our central and autonomic nervous system. The next level up from that is structure, function, and cell health. Above that we have elimination and absorption, and then emotional, spiritual, nutrition, and physical activity. And the reason why we layered the pyramid in that way is because working from base to top, we're seeing the most impact in our health when we have a healthy and good functioning nervous system. So we can come back to prevention and say, for us, we don't even necessarily want to be preventing a condition or a problem. We actually want to be optimizing our health and well-being. And by optimizing, we're not trying to avoid something. We're trying to live at the highest state of wellness and highest state of well-being and highest expression of life in ourselves. Again, is bypassing something that is looking at it from a condition standpoint, and really we're looking at creating well-being. Any thoughts on that, Leah?
No, I love how he just described that. Optimizing our health instead of preventing illness or injury or disease is such a better way to look at it than if you have something in mind, I'm trying not to get this, or I'm trying not to be diabetic, or I'm trying to generally be healthy, instead of I'm trying to have the best, not just internally, externally, mentally, state of health that I possibly can, is certainly the mindset that we want all of our patients to be in. So
you like that?
Totally agree. Yeah, great job.
By the way, it is our Christmas party today, which is the reason why we have our ugly sweaters on for this video. Just happened to be the timing. So we're rolling into the new year, actually. We're planning for that. And again, looking at those levels of the pyramid, there is actually a lot that people can do to try to optimize their health. And if we're optimizing, so we're looking at, there's this spectrum, this health spectrum, life spectrum. And on one side of that is optimal wellness and well-being. The other side of the spectrum is death. And so we want to be trending in the right direction. Everything that we build into the health pyramid is, the goal of it is trying to help you trend in that wellness direction. So the fact is, all components of our health pyramid are going to help us to really, of course, prevent problems, but optimize our health and well-being. So just if we kind of look through some of those pieces and parts, things that we can pick out. One of those things that is often overlooked, so people will say they get routine testing, mammograms, blood work, blood pressure, they get their blood pressure checked, your general blood work that maybe you do from a primary care doctor, like people regularly do those things and think that that is somehow preventing. Or we also hear people say, well, this person was healthy until they had whatever. Mm-hmm. And Leah, how true is that statement actually, or what's the difference between what you're looking at versus some of these other tests?
Yeah, so like your general physical blood work, or the blood work that you have to kind of see like, is a medication doing what it's supposed to be doing, and that kind of stuff, follows just these general guidelines that the lab has labeled to these numbers, or numbers to these tests. And basically, if you fall in this large scale of that
It's
range,
an average, right?
Yeah, an average range, somewhere in there, you're normal until you're not. So then once you reach either too high or too low, there's typically some kind of medication involved to get you back in the range. Now that range is not person specific and optimal, where when we do functional medicine, our ranges are much more specific to where your body should be if it's functioning well and as it should be, not just if you're already sick and we can diagnose you with something. So our ranges are different than what your lab would give or your primary care doctor might go over with your general physical.
And what about the things that are tested? So what is considered normal or abnormal is a difference. Because guys, we want to be in the optimal range, not in a severe range. So we hear a lot of times people will say, my doctor said my blood work was fine. Well, fine means it was average. Doesn't mean that it was necessarily well. But also, there's many things that we're actually surprised that aren't tested regularly.
Yeah.
Most of that is because it's not covered by insurance. But can you talk about that a bit?
Yeah, so your yearly physical has maybe 4 to 5 tests that are typically covered by insurance 2 times a year. So that's generally what's run. Now that'll be like your cholesterol and your blood counts and your liver enzymes, that kind of thing. You know, doctors want to look at, especially if you're on a medication for that. But there's no more extensive looking at like vitamin D levels or inflammation levels or even in people that have symptoms. So our blood work is a lot, there's probably, 30 things run or something like that. It's crazy. It's a super extensive panel and we don't use insurance, and then so they can't come back and tell us, well, you can't run this test because we don't find it medically necessary. The insurance company gets to tell us that it was not medically necessary.
Right.
And then the patient gets a bill for that lab if we had used insurance. They don't know what's medically necessary necessarily or not. It's not their patient. They don't know what they need run. They don't know what supplements we're trying to see if they're working or not. So we like the way that we're able to just do one extensive lab panel, not have to deal with insurance companies, have our optimal ranges. It's a way deeper dig into what your health is doing.
So not only that, but there's also specialized testing too. So things like food sensitivity testing, that can help with prevention of irritation, right? Because if somebody does have foods that they're sensitive to, that can be an issue. We can test for heavy metals in the person's blood, hormone levels, but salivary hormone levels, which is more sensitive than blood levels for hormones. We can do that over a 30-day period. Sometimes we can do that over a 24-hour period. Again, those are much more detailed. A lot of times the level of depth of testing is important too. But just testing by itself doesn't give us any benefit other than to know what problems we should be working on. Then we have to actually do the work again to optimize. So several things there. One of them is chiropractic. So when we look at our pyramid, the foundation of that pyramid is our spine, our nervous system. Our spine protects our nervous system. So when we have bad alignment in the spine, it's disrupting signaling from the brain to the body or from the body to the brain. That message gets distorted. It decreases our overall wellness. And again, we're talking about optimizing. So that doesn't even have to do with pain. It just has to do with the signaling being disrupted because of dysfunction in the spine. So there are things that a person can do with that, doing the spinal hygiene exercises that we give our patients based on what their x-rays look like. Utilizing the technology. So we brought in things like frequency-specific microcurrent, pulse electromagnetic field, vibration with oxygen, infrared sauna, infrared light, red light therapy. All those things have actually been shown to stimulate mitochondrial function, increase circulation, improve energy production, which, by the way, if we're doing that, then we're not just preventing problems, but we're optimizing our overall health and well-being. And then we get into things like nutrition, vitamins and supplements. Again, from the detailed testing, we can give detailed recommendations. And then lastly, we're just trying to take these all things to an advanced level. So then we also look at physical activity. So Dr. Brown, his programs are looking at the individual, looking at resting metabolic rate through our cardio coach testing, looking at VO2 max, and exactly being able to be specific about the type and the ways that people eat and their exercise. Again, those are all just advanced ways to level up our health, and really that's what we're going for.
Definitely. Especially, I mean, we're now wrapping up 2 years of being in a technical pandemic. So if you haven't already thought, maybe I should become the healthiest version of myself I possibly can, might be a good time to do that, because that's apparently it's not going anywhere.
Not anytime soon, but we do know your best defense is the healthiest.
Definitely.
All right, that was a good one. So guys, please go into our page, subscribe to it. We're going to be continuing to put these things out on a regular basis. The next video is going to be just as awesome as the ones that we've been doing. And then the other thing is, if you would like to have more information or you'd like a conversation, we always offer an opportunity to either do a free consultation in the office. We look at your health history. It's our advanced health consultation. We look at your health history, your problems, things that you would like to try to change or improve. We dig into that and see where we should go from there to help do that. We also offer a free phone discovery call. So it could just be a phone call with myself or Leah to find out if there's something we can do to help and something that we should investigate further. That's it for now, and we'll talk to you soon.